And welcome back. In honor of Alzheimer's and Brain Awareness Month, Robert Underwood, a neuropsychologist with UofL Health, here to talk about brain health and the neurological changes that are associated with Alzheimer's disease. So thanks so much for being here. We really appreciate it.
You're welcome. Thanks for having me.
And as we're starting now, we're kind of asked about the conditions that impact how a person, thinks, their mood, how Alzheimer's can, impact all those things.
Sure. Alzheimer's disease is well known to affect memory, largely early on in the course. Also, language changes can occur in Alzheimer's disease. So people might forget conversations, recent events. They might forget where they place things in the house or how to do things they used to know how to do at home. It can also affect mood and personality. We might see changes like irritability, agitation, lack of motivation, things of that nature.
When you said language, do you mean even some slurring, things like that?
Not as much slurring, but more troubles finding words, coming up with what you want to say, kind of like a tip of the tongue phenomenon, really, but a little more pronounced in some cases where you might have trouble thinking of the name of that object or what is that called.
And how can a neuropsychologist help when these kind of symptoms start showing up?
Sure, great question. So as a neuropsychologist, what we do is we give special tests to our patients that measure their thinking, things like memory, attention, problem solving, and to see are those skills normal for their age or are they not? And if they're not, then we work with their providers and their medical team to kind of help with a diagnosis and also maybe come up with strategies to help them live life as independently as they can and overcome some of those problems or compensate for some of those problems they might be having with memory loss, such as helping with driving, helping with medications, helping them come up with a plan for how to move forward in their day-to-day activities.
What are some things that all of us can do just to improve our brain health if we're worried about this?
Right, no, great question. So there are many things we can do. I think we have pretty strong evidence now to know that there are lifestyle factors and lifestyle changes that we can do to kind of slow our chances or reduce our risk of getting Alzheimer's disease. Things like sleeping well, getting at least 7 hours of sleep, eating a Mediterranean type diet that is rich in proteins and fish and grains and fruits and vegetables, staying socially engaged, anything that's good for your brain, mentally, physically, socially engaged in different activities, maybe learning a new activity such as an instrument or a foreign language or even participating in a group. Is important. And of course, exercise. It doesn't have to be, a marathon every week, but something like just get your heart rate up once a day or maybe once a week, a vigorous activity for 90 minutes or so. And then if you have diabetes, high blood pressure, high cholesterol, we want to treat those because that can certainly affect the blood flow to the brain and increase your risk. And
also, what signs would we be seeing if in a loved one and what can we do to help them?
Sure. So as I mentioned before, you might notice they're a little more forgetful. They might be repeating themselves or forgetting something you talked about on the phone, maybe just after a few minutes. And so I would reach out to the primary care doctor. They can schedule with a neurologist. They can run some basic tests because sometimes there are treatable or reversible causes of these problems.
And how do you know if it's it's got to be a repeated pattern because, some of us, forget what we had for lunch yesterday.
Right. I'd say if it's a marked difference from how your loved one used to be, or if they knew how to make those cookies super well in the past, but now they don't taste right because they left out an ingredient. I mean, something like that would be a concern for me.
All right. I know it's affecting so many people, and you guys are certainly helping. Thank you so much.
Thank you for having me.
And you can always check at UofL Health if you need more help in this situation or just have some questions.